This is Gina. She's been my patient since 2004 or
4 or 5.
2002, something like that, yeah. Yeah, well, time flies when we're having this much fun.
I know, right?
Her original injury was a
navicular fracture of the right foot.
She went through several surgeries and lots of skin breakdown. So she developed a syndrome called chronic regional pain syndrome. And because of that, the skin never really heals. The nerves begin to retreat, and then they lose their innervation to the muscles, so she loses power. And you get all these bone contractures and ligament contractures of the foot. The past almost 2 decades, she's had lesions where any kind of light scratch on her foot will leave a wound that takes forever to heal because the tissue just cannot regrow because there's no growth hormone stimulus and lots of other variables. When she finally came to me, we put her on all of the supplements that we know stop the degenerative process and promote healing. So in the past 2 years, she's been able to get workman's comp to approve human growth hormone. And because of that, she's had no episodes of
ulcerations and very few fracture blisters that cause the ulcerations.
You put back in the human body what it needs, and it knows exactly what to do with it. Everything we've done has made enormous progress, but she still had a, for the most part, paralyzed foot.
Correct. Fixed contracture.
So recently, she was attending therapy in our therapy program here in my office, and she was, one of the therapists introduced something called mirror therapy, and I'll let Gina describe that.
And I'm going to back up for just a minute, going back to when I first saw you, just to emphasize how well the treatment that he does works. When I was a patient, I had been in wound care for almost 3 years. When I came here, we did no hands-on wound care. He did his normal blood routine workup and saw what I was deficient in, did his vitamin, enzyme, mineral therapy, and the growth hormone, and in less than 6 weeks, my wound was completely closed. Back to the mirror therapy, I have been in my wheelchair and or on crutches, unable to walk, and some new pain. So Garcia put me on the baclofen to help with the muscle cramps, and then suggested we start mirror therapy.
Dr. Garcia is an anesthesia pain doctor.
During the first 4 visits, I didn't do anything to move my right foot at all. And what we do is we use a full-length mirror. My right foot will go in a tote of water that's about 104 degrees, and I'm wearing a sock because of the sensitivity to my foot to touch. And so I can't see the right foot at all. And what I do is I will do exercises with my left foot, and I have a sock on it as well, while I'm looking in the mirror. So I will do exercises that will plantar flex and dorsiflex while watching the mirror image of my good foot. And we do usually 2 sets of 10 if I can make it. And then we'll do, let's say, the windshield wiper, which is your inversion and your eversion. And when I first started this, I had no movement at all doing the mirror therapy. And in the initial evaluation David did, I had no plantar flexion or dorsiflexion. After the first initial 8th visit that work comp approved, we had to do a re-evaluation. I had a 20-degree improvement in the dorsiflexion.
Very nice. Now bring them up. Wow. That is phenomenal. Push down again. Good. Now pull them back up.
And now when he does the re-evaluation Thursday, we'll find out the degree increase in the inversion and the eversion.
They're more similar than you think, Gina, because the smaller board, it's going to move more because there's a greater distance. It's up higher, and the one on, on your right is it's for people that have more severe ankle problems, and there's not as much motion, but they're actually probably a lot closer to being the same than you think.
I'm looking at a mirror and watching the mirror image, so my left foot looks like my right foot. So my brain is watching that, and in the first 4 sessions, I didn't move my right foot at all. And this is the crazy part, is I would literally have to take a break from doing like the toe crunches because my toes would cramp on my right foot, even though I wasn't moving my right foot. My brain thought that I was actually working those muscles and ligaments in my toes. And then when we did some of the inversion, eversion movements, I had to stop because my ankle started hurting really bad, even though I wasn't moving that ankle. So it's just amazing to know and to watch how your brain, concentrating on the mirror image, thinks that it is truly my right foot doing the work when my right foot was doing nothing. And it's neat to see the movement that I can actually get in this foot now that I never thought possible.
That's phenomenal. That's absolutely fantastic.